Hey, this is Dr. Demetropoulos giving you an update from the front lines on the fight against COVID. And the reason I wanted to make this presentation is that we've seen a dramatic uptick in the number of COVID cases. Last week, the most we saw in a day was 9 cases in a day. This past Monday, so 2 days ago, we saw 19. The day after that, we saw 16. We're seeing this dramatic double-digit uptick in the number of COVID cases. What's interesting about it and what's concerning me so much is that this uptick is in younger people and the severity is greater. They are sicker, and many of them are at the point where they may need to require hospitalizations. We know our hospital ICUs are already getting filled up with both younger and sicker patients. We're also seeing a trend, and this is a worrisome trend, in which we're seeing patients that are vaccinated that are being infected with COVID. The good news there, and this is very reassuring to me, is that of all those patients that we've seen, they've been less sick. In other words, it's more like a common cold, and we've not had to intervene. We've not had to send any of those people to the hospital. They've not, their illness has generally run its course for the people that we've followed. And so from that standpoint, the vaccine is doing its job. It's keeping people from getting sick and having complications. And that's particularly compelling considering the subset of patients we're talking about. These are people who would normally be the sickest patients and at risk for the most complications. So that really makes me feel a lot more comfortable about the vaccine being able to protect us. This uptick, though, the only way we're going to be able to address it is for folks to get vaccinated. I can't tell you how many people I'm seeing out there that are still not vaccinated, people that are at risk. If you're overweight, if you have diabetes, if you're over 55 and have hypertension or cardiovascular disease, you're at risk and you need to get vaccinated. Mississippi still has one of the lowest vaccination rates and compared with all other states in this at-risk group over 65. And then in our younger group of people, it's not just it's like a viral illness and you get over it now. People are really getting sick. And the only way we're going to be able to keep folks out of the hospital and avoid people having a lot of serious complications is to get vaccinated. So that's my plea here. Whatever your status, whether you're a 22-year-old or you're a 65-year-old, we need you to be vaccinated for 2 reasons. 1, to protect yourself from the complications, and then 2, to help us solve this problem. It's going to take every one of us, meaning each one of us, to get vaccinated. We can't depend on all right, I'm going to be okay if I get the illness and it won't be any big deal. But yeah, you allow this pool to still exist where the virus can easily infect others. And until we get a large group of the population vaccinated, so we shrink that pool of more susceptible individuals, then we're going to keep having this. I know nobody wants to go back to the lockdown, the mask uses constantly, not being able to gather. You can't go to church, you can't go to kids' activities. People are put out of work. We don't want to go backwards. And that's what I'm afraid that's going to happen if we don't start getting the vaccinations started back up in a real aggressive way. So look, you can come and be vaccinated at any of our clinics. Just call and make an appointment. You can come in from 8 to 12. They give the vaccinations. They watch you here. Then you can go. There's vaccinations available through the drugstores, through Walmart, through Walgreens, those type of vaccination sites as well. But please get vaccinated. That's the biggest thing we can do to help manage this pandemic and to get it over with and for it to stay over with if we have enough of the population vaccinated.